Well, nurse practitioner is taught along the nursing methodology of teaching, whereas the physician assistant, they're taught with the medical module. So we are going through the same classes that actual physicians do. For example, my school at that time did not have a cadaver lab. I went to Yale University, and that's where our class took our anatomy class. Was at Yale University, the same building where the medical students took their classes.
Well, that 6-month internship I did was absolutely phenomenal as a speech pathologist.
Yeah.
Okay, they had me doing things that were unbelievable. I had to go to ENT lab every Monday morning, and I had to do the demonstrations of indirect laryngoscopy to the new residents coming in. I wasn't certified, but I knew how to grab a tongue and, then the doctor would say, doctor, would you demonstrate for me? Certainly. There we go. I then went to lab work. We did brain slicings on Fridays to try to correlate site of lesions with patients with communicative problems who had passed away. Did EEG readings. I mean, all kinds of neat stuff. And it was such an excitement for me because I didn't have the educational background particularly. And then I ended up going to a graduate program where I took a course in neurophysiology with the medical students. It blew me. We had a guest lecturer one day, Sir John Eccles.
Oh, my.
Yes. He did those split brain in man's. I couldn't put my jaw back up in my face. He walked in the door. Oh my God! It's great experiences, great exposures, I guess. But the bottom line is, medicine is such an interesting, integrative system, and I have such respect for people who know the body, know the system. Actually, having been through medical training like you or physicians. Same thing. I mean, you have to have that background.
And we're still learning more as each day goes on. As technology progresses, more and more is learned about the human body. And that's why continuing education is so important. I mean, like PAs, we're required to have at least 50 hours a year of some type of continuing education.
50 hours a year?
50 hours a year. Yes. So we are constantly learning, whether it's through journals, whether it's through lectures, whether it's through classes. We have to keep up with technology.
We, with our national certification, had to do 15 hours a year. 50, that's a lot. Yeah. But again, hey, it's out there. It's going to make you better,
Not make me better, make my choices for patient care.
Thank you.
Better.
I'm sorry. You are better anyway. I'm not going to get personal about that. All right,
Okay.
But before medical school and all that, what did you do before that?
I was a dental hygienist for 28 years.
Wow.
But I did always want to go into medicine, just never had the opportunity to do so until I put my daughter through college. And I started school the semester after she graduated. And I went back and finished my bachelor's, then on to my master's, and here I am.
Wow. Tough, long. Yes. My niece is 2 semesters away from the ARNP program. And it took her 4 years to get her associate degree because she worked at a Party City. And then she applied to the nursing program. And like 300 kids, they took 60. And she's had straight A's all the way through college, all the way through all these levels. And now she's getting right to the brink of finally getting this done. And she's a psych nurse. And she loves psych.
Oh, there's such a need for psychiatric care because that is such an underserved portion of healthcare.
Yeah. And she just loves it. She's a little bitty thing. You'd think she wouldn't be able to grab somebody and settle them down, but she can. Well, you don't do it that way.
You're right.
Get the arm behind the back and twist them. And get the cuffs on them. Yeah. No. All right. Now, you've been sitting here, and then we're going to torture you next.
Absolutely.
Your background is, Chrissy?
My background, I was actually a vet technician back in the day.
Oh, cool.
So, and then I just kind of wanted to get into the healthcare and be more involved in the office environment and kind of start my way up. So I started as a secretary and just built up an office, and it went really, really well. And when I first started, we didn't have a lot of companies that would do anything mobile. So we had like home health and x-ray companies and ultrasounds, but now we actually have podiatrists, there's dentists. We have a bunch of other companies that actually provide mobile services, but it's nice now because we can actually offer those type of services as a recommendation for our patients in their own home, so they don't have to go out and see, for anything that we recommend for the patient. But it's amazing on how much it's grown.
Now, this is under Medicare certified.
Yeah, and there's even a behavioral therapist too that can come to the house. Yes.
Wow.
Yes.
Fantastic. How do you deal with the dental issue with Medicare?
Well, with the dental, it's more preventative. So if the patient is actually having a problem, they would need to go to the office, to the dental office. But for routine cleanings and things like that, they can do it in the home.
But then again, that's not reimbursable.
No, Medicare does not
So
cover
they're going to
dentistry.
have to have a policy of some kind, or
yes.
Or
yes.
I don't have a dental policy, but I have a dental discount program.
They're offering that now instead of actually policies.
Yeah, it's a lot less expensive.
Yes.
And it'll give you like so many dollars off if you're going to have x-rays, and x-rays are $120. You may pay $90. If you have a denture and it's $1,500 or $1,300, you pay $800. So you get this discount program, which works fairly well.
If you don't really have a lot of problems going on, it works out perfect. But if you've got some issues, no, it doesn't.
Well, that's true about healthcare in general. If you're looking at a wellness kind of program and you have very little issue, a Medicare Advantage program might be more appropriate than regular Medicare. On the other hand, if you have more extensive issues, the straight Medicare might be more appropriate. We put together a new group. Oh, it's fabulous. It is fabulous. It's called the Treasure Coast Health Coalition. And LabStop is in this group, because of the DNA testing. We took experts in the fields of attorney, independent living, assisted living, nursing home, special dementia care, special placements for people to go to ILs, ALs. I do lectures on senior bullying and senior abuse. And we take this on the road to communities. We just did a series of 5 or 6 up at on Hutchinson Island. And we're going to be setting up these seminars, and they're free. And we're just saying we want to take information out there. I have a Medicare expert. She works for SHINE, which is a federal and state program, seniors helping individuals, insurance needs of elderly or something like that. And she's an expert in Medicare A, B, and D. And I have Margaret Tanner, who you probably know, the lady who takes all the pictures at the.
Yes.
She works with the Physicians for WellMed. And so she talks about the Medicare Advantage aspect. So, we're able to go into a community and say, here we go. We want to talk all these things, and this is how you do stuff. In fact, I'm setting up a seminar with one of the communities that's going to be, let's say it's a Bright Star community, just independent homes and stuff. Okay. The title would be, What Happens After Bright Star? Now you're having problems. What do you do? Where do you go? What's available? And the panel then will adjust to all of this stuff. How you go through series of steps, in terms of independent living to assisted to nursing home care, and how do you qualify and how do you apply and all that stuff. People need that. That's, again, taking the fear away from some of this stuff.
Education.
Yeah.
Yes.
And like I said, LabStop is one of our shining stars too. You get Eric or Veronica standing up there to give a talk. Boy, they really tell you what's going on.
They're great.
Yeah. And so we need things like that out there. And keep us in mind, if you ever run into a situation where you think, well, there might be a need to come to this community, we'll be happy to do that.
Okay.
And each one of these people, when I was putting this together, they said, thank you for inviting me. Rather than, oh, not another thing to do. They were very impressed that, we would put this together and work together.
You have to take the time to do that kind of stuff, because if you don't, there's so many family members, they don't know what's out there and what's available to them, and they need to know too.
Well, Donna gets bombarded with questions when she goes to a home about what about this and how about that, and and they're just eager. Tell me things, please.
And I try to give as much information as I have in my head, and if I don't have it, I will find it within.
Dig it up for them.
Yes.
Very good.
Yeah.
Very good. Well, Mike, I think it might be time we just went past our little time for our commercial.
Okay.
So how about if we take a little break here a minute?
WSTU, it is 9:30. Let's go back to the forum with your host, Pat Sacco.
Thank you. And we're here with Advent Healthcare Association with Chrissy and Donna. And we were going to ask where you are from originally. And Donna, you said you're a floater. You were a floater.
Yes, my father was in the Air Force, actually Army Air Corps, got out, couldn't stand working in the steel mill, so he went and joined the Air Force because he loved being on the planes, and I was in the Air Force for 30 years. So we moved around a lot.
Wow.
I did live in Connecticut for 30 years. That's when I graduated high school. I moved to Connecticut and went to Quinnipiac University. That's where I obtained my master's. And my husband and I came down here for a wedding, and he said, "This is it. We're going to move down to Florida." And that's what we did.
This is it.
So-
By the way, well, very good. And Christy.
Well, I was born in Newburgh, New York, and I was about 2-3 months old, and we moved down here to Florida to be closer to family. So I'm pretty much a Floridian, I think.
Wow.
Yes.
Good for you. I spent my first 50 years up in Western New York, near Rochester and Buffalo, near the lake effect.
Mhm.
I keep telling this story. One March, I was lamenting to a friend of mine. I said, "Gee, we had 10 snowstorms." He said, "No, we only had 3. I said, "Well, what were the other 7? He said, "Lake effect, where the winds come across the lake and then dump." I said, "Well, tell the difference to my snowblower." We still got 2 to 3 feet of snow. I didn't care what you called it.
No.
It was there. So we were very happy to get out of that weather. And we had a son that was still in school, so we waited till he finished. We were looking at retirement down the road, and I thought, I don't want to move to Flagstaff, Arizona, and not even know where the grocery store is. So we came down to Florida to finish up our professional work, get acclimated to the system, and then when we retired, it would be a little more comfortable. And it worked out really well for us to do that. I don't know why people want to get away unless it's a weather thing,
Yeah.
you know. And wherever you move, there's always a potential of a natural disaster
Yes. Everywhere you go.
everywhere you go. And I think the hurricanes are probably the safest form of a natural disaster that we could encounter because we don't have a lot of death. But floods and tornadoes and those kinds of things, there are many people who die. And we're really lucky that we're on a system where we get enough advance notice that we dig in and we're okay. Anyway, okay.
So office staff.
Office staff.
With
Let's talk about
Advent.
office staff.
We have a lovely staff. Tiffany, she is our medical assistant, and she's been with us for several years now. And Julie, she is our medical secretary, and she's been with us for about 1.5 years. And we're all friends, and it's a nice environment to get together with them. And it's all about patient care, and they're just really great girls to work with.
Terrific.
Yes.
And without them, without the support staff, I would not be able to do what I do.
You know, I don't hear that often when we talk about staff. Oh, we have the bookkeeper, we have this, but you're giving a personal touch saying, yes, we really do get along together,
Yes.
and which is good, which is good. It's more of a family kind of environment.
Yes.
Terrific. And then from the treatment side,
well, our medical director is John Gozar. He is an internist ER physician. He's been in the area for over 16 years.
Yeah.
About 16 years. He graduated from the University of Illinois and the University of the East. He did a residency in emergency medicine at Cook County Hospital. Also was a hospitalist and in urgent care. He sometimes volunteers his services at Broome County Health Center, and I think that's up in the Chicago area where he was from. He's a fellow of the American College of Physicians, the American College of Emergency Physicians, and the American Society of Internal Medicine. And he's just a great all-around person to be with.
Like that new friend I found.
Yes.
Who's going to be an ER physician.
Yes. He really enjoys what he does. He loves being in the emergency room and trying to avert a crisis. That's why most people go to the emergency room.
Right. And again, looking at, I had mentioned WellMed as part of the system. I went to a presentation of one of their female physicians, I think at Fort Pierce, got to talking with her. She said, "I love doing home visits." And I said, "Wait a minute. I said, you're a physician. She said, no, I love doing home visits. She said, well, if it were up to me, that's all I would do during the daytime.
And that's all I do.
Yeah, right.
That's all, because that's what I want to do. That's what I love to do. I originally was going to get into pediatric surgery, but I found during my clinical rotations it was very hard, not only sticking the babies because you had to do procedures on them, but dealing with the parents who are drug addicts and trying to take care of their crack babies. And I just, I physically and emotionally couldn't cope with that.
But there's the negative side of that too, with death,
Yes.
that you have to cope with.
Yes, there
And
is.
you have to divorce yourself of the fact that you didn't cause it, and you weren't the one that promoted it.
Well,
You know?
one of my rotations, my elective rotation, I actually spent with my mother's geriatrician in Alabama. And his office ran the gamut. There was home visits, skilled nursing facilities, assisted living facilities, group homes, and then there was a whole wing at one of the local hospitals for intensive long-term critical care that we took care of patients at, plus seeing patients in the office. And on my last day, we did a home visit. And it still brings tears to my eyes to talk about it, because the woman was living with her daughter. The woman obviously was in her final stages of dementia. She was not mobile. She was in bed, but the grandbabies were sitting on the bed playing Barbies. The preacher was there reading out loud from the Bible to her. It was a very calm and peaceful atmosphere. Family was coming in. They were talking to her, even though she wasn't responding. You know, people still hear. And they were telling her that, yes, it's okay if you pass away. We're okay with this. You're going to the next level. And I thought that home visit was just amazing, absolutely amazing. And that's what I want to do.
And it didn't take her long to pass.
No, she passed that night.
Yes.
Yeah.
I worked 12 years. I was not a resident. I worked 12 years in a nursing home. And I would see when they got permission. You know, somebody would be semi-comatose on their way out. He would, every day you'd check, is she still alive? She's still alive. And a priest or a minister or someone would come in and say, it's okay, you can let go now. And they do.
Yeah.
You know, and that's...
A lot of people wait. They wait for permission.
For permission.
That is okay, because they're worried that what's going to happen to their family. And that's what keeps them going.
There was a 102-year-old woman in the nursing home. I've been there for quite a while. It was a favorite of everybody. And she hardly ever spoke. And one day the social worker went in and said, hi, Janie. And Janie looked and said, I'm going to meet my maker, and died the next day. You know, it's like, whoa.
Yeah. Yeah. It gets to you.
And I think when you get your permission, you know, and this is, depending on what you believe, this is just kind of a way station. I went to a funeral of a friend. I don't like to go to funerals. I was raised in them. Italian people, their specialties, they have these long, drawn out things in black you wear and stuff. And I didn't want to go to this, but I did. And a very young priest got up to give a little sermon. And I thought, oh boy, here we go. You know, we're going to pull something he read out of a book somewhere. And he gave one of the most beautiful descriptions of heaven and earth. He said, earth is like being in the womb. You're in this dark, warm, wet place. And that's all you know. This is your total world. And all of a sudden, you're born into something you never, ever would have imagined that you come into life. He said, earth is like being in the womb. Heaven is like being born. I thought, whoa.
That is a wonderful way.
Thank you very much.
Yes.
I'm influenced by things like that, you know. And so, I think we all have hope that there's something beyond us. I would certainly hope so, because I'm not done yet. I'm sure that, see, if I had been a disciple of Christ, I would have been the one going to the next town to set up lodging and then lunch, and, getting the organization where you want to put the crowd and stuff.
Yeah.
I would do that kind of thing. So I'm hoping that maybe eternity has a little bit of that for me too. But it's a wonderful thing to treat people. It's a wonderful thing to have someone available to calm your fears, to give you something, give you medicine or encouragement or something, or to suggest things that make you better or make you healed. It's a miraculous thing that you do.
Give them comfort, whether it's just to maintain their quality of life or just a hug and a kiss. One patient told me that's the best medicine she's had in a week.
Oh,
Was just the hug that I gave her.
I was heading into Sam's one time, and this little old lady with me was starting to stagger, and I grabbed her. I said, "Careful, don't fall." And she turned to me. She said, "Thank you for two things." I said, "What?" She said, "Thank you for studying me, and thank you for touching me. It's been so long since a man touched me."
Aw.
And I gave her a hug, and we walked in
Aw.
together. How sweet!
Yes.
She's probably in her 90s. How sweet a thing to say, you know?
Mhm.
God, I would have
Yes.
probably just hugged her all day long. You know? And we all want that too. We want that comfort, but we're afraid. We're really afraid that we mess around with people.
Yeah, you just don't know how they're going to react. Like one day I was in Publix in the morning, and this elderly lady was using the little scooters to get her groceries, and she actually wanted to get an item at the top shelf. And I asked for permission first. I said, "Do you need help with that?" And she said yes. And then I, put my hand on her back for her to kind of sit down slowly in the scooter, and got it. And nowadays people just seem to be so busy they don't see that kind of stuff and help the elderly and give that extra attention that they need.
Let me tell you a cute little technique. Tease people in the grocery store. Tease them. Let's say you got your cart and they say, "Excuse me, would you move your cart?" And they'll say, "Sure, give me $1." And they get them to laugh. Or some lady's fumbling with their purse. They'll say, "That's okay. I don't have anything to do till tomorrow. Just take your time." And we get them the little joke and stuff. And then they talk and they're fine. But they're like plastic when you walk down the aisles, unless you get their attention. And you discover they're kind of neat people.
Absolutely.
So next time, just charge $1. I've never gotten $1,
Hey.
by the way. Would you move your cart? Yeah, $1. But yeah, we all want that help. We want all that touch, but we're very leery about what goes on these days. We got to be very careful.
Yes, you do. But it's important to let people realize that they're human. They count.
See, my contention is the older you become in this society, the more invisible you become.
Mhm.
It is becoming that way.
Yeah, right. And we don't want that to happen. Almost every other country in the world reveres their seniors. They're wise. They've been around for a long time. The government passed a beautiful bill and never funded it. I was on the advisory board of the Area Agency on Aging, and they had announced a new program that the government just had passed legislation for. It was to re-employ retired people in their field. Let's say you had an architect who retired after 40 years. Well, they could apply for the program. They could hire him half-time. They could pay half his salary. The government would pay half, and he could advise new architects rather than going to get coffee or folding envelopes or stuffing envelopes.
Not just a wonderful experience
In
for
their field,
him.
but the money never came.
Oh,
I like programs like the foster grandparent program, where you get assigned to school and a teacher assigns you to a kid who's having trouble with math. And you sit there and you help him with his math. And you go there regularly and help him with his math. Now, not only is he getting tutoring free, he's getting the image of an adult working with him, giving a little more image of, worth and stuff. And I guess they get a pittance of salary for that. Those kinds of things, it's just helping people. So I think that's what it's all about.
Yes.
What do we do to help somebody? Like putting a hand on the back and reaching in the shelf and giving an encouraging word. These are significant things to them. And we don't realize the impact that we have on people. So the thing is, you keep doing what you're doing. You keep looking for opportunities to do these kinds of things, especially on the job and off the job too.
Yeah, that's why we try to provide the access to care that the homebound deserve. I mean, how many people can afford a cab or pay an ambulance because they're bedbound? I mean, I had one patient that they actually literally put the grandma on the stretcher and put her in the back of a van and took her to the doctor. I mean, that the stress, physical and emotional stress of doing that, it was just,
I'm working on a program now to kind of sort of get some funding for it. It's called Neighbor Helping Neighbor program, where you say, I want to volunteer, but I don't have time. You know, I can't deliver 12 meals on Meals on Wheels on Thursday night or whatever. I say, okay, you get Molly. Molly's your patient. Molly lives a couple miles from you. On a Saturday morning, you call Molly and say, what do you need at the store? I'm going to get my groceries. So you get hers, you deliver them, you pay for them, you deliver, she pays you, and you go home. Every couple months, she may call you and say, gee, the doctor put a script at Walgreens. Could you pick it up for me? Well, we got everything registered. You go buy it. She pays you. You're done. Now, that's all you do. And it's going to take you maybe 10 or 15 minutes extra on a Saturday. Make a run once in a while. And you've gotten the two essential things she needs at home, her medicine and her food. Now, she has to be able to pay. But how do you pay the $50 to get the transportation to the store?
exactly.
And how do you get to the drugstore and all these things? You know, they're not mobile enough to walk down to get on the community bus. One-on-one, simple thing, no charge. I would do a background check on you. That's what I need the funding for.
Yes.
Why haven't we been doing this? Why have we not set up a system to help people who have to have things at home? They really can't readily get out and get them because we've never thought of it.
Mhm.
That's true.
And I work on a local basis. I will never apply for a federal grant. They're too complicated, and it's too corrupted with, who gets what. So I deal with the community. And Reagan said, don't ask your government, ask your neighbor. And I get all these agencies, and LabStop included, they give me a little bit of support financially, and I use that for buying the things for health fairs, whatever we have to pay for this and that. And that's how I keep going, and the radio program and some of the publications that I have to purchase and stuff. But it's a collaborative effort. And the nice thing about it, when an agency supports me, LabStop, for instance, is saying, we think more than just our business. We think about the community also. And we're supporting this agency that does things for the community. And to me, that's one of the best ways of marketing.
Yes.
We do these things, plus we also have a job.
Mhm.
I'm not recruiting,
No, I understand.
but those things. And there's so many needy situations out there. We had a situation. I had a gal call me. Her son is autistic. Well, she found out there were dogs for autism, dogs trained to take care of autistic children. And she got on a kick of starting to raise some money. And I mentioned it on the air one day. The next morning, I got a call from a secretary. She said, my boss was driving to work and he heard, her appeal. He said, give me the phone number. And he donated $1,000.
Wonderful.
Wow.
It cost $15,000 for her to get that dog. She got it. She set up a nonprofit organization to raise money for dogs for these kids. And he just loves his dog. And if he starts getting a little fiddy, the dog will come and put her nose on his lap.
Calm him down.
Calm him down. They anticipate if they know the dog knows that there's something they shouldn't eat, they start putting him out. The dog will with his snout, push the hand away from the mouth.
It's amazing what they can.
It takes months to train them.
Yeah.
But it's, yes, and with autistic individuals, they have a hard time relating to other life forms. Here they bond with their animal, and I'm sure that is healthy to them toward humans as they go through this thing. It was a great program. It's like I say, there's so many things out there that we really need to support,
Yes.
but can't support them all.
You want to, but
Yeah. Anything coming down the pike with your company? Anything exciting that we're going to be looking at? A new program? Of course there is. Go ahead.
we just actually have coverage in Wellington area now. So we
Okay.
go all the way from Port St. Lucie West to the Wellington area. So that's a big step for us.
Adding more staff?
Yes.
Yes,
Mhm.
good.
We actually have Lori Bannon, who's a nurse practitioner. She is recently moved from Virginia. She has family here. So she's certified through the American Academy of Nurse Practitioners. She's a member of the American Association of Nurse Practitioners, and her background is emergency medicine. So
Oh,
she is
wow.
a good go-to girl.
Wow, yeah.
Yes.
She could do your initial visits right out of the hospital.
Yeah. Well, that is one service we also provide is transitional care management, because when people are discharged from the hospital, they may not be well enough to drive yet. They may not be well enough to even get out of bed or get out of a wheelchair. So how are they going to see their doctor within days of being discharged? That's where we can come in, do the transitional care management, make sure they're getting the labs they need, the home health agency with the nurses and the PT, physical therapy and occupational therapy. And we transition them so that when they are ready, fine, go back to your primary care that you're so comfortable with. We will send our visit notes to the primary care. We will keep everybody up to date with what's going on. But we're helping that patient get better so that they can get back out of their home into society.
And that eliminates the need to go back to the hospital,
It
which is our
does.
primary concern.
Yes.
We don't want those returns.
There are so many returns because they're not getting their
There's
transitional
nobody there to
care.
help, and I guess I
No.
have to go back again.
Yeah.
You know, what do you do?
Yeah.
Then you call the ambulance, and you run up in
there's
thousands more dollars to get back
Mhm.
in the ER, to get back into the system, and it's crazy. But again, you're much cost effective given what you do.
Not
okay?
trying to be cost effective.
No, but it ends
yeah.
up being that
Yeah.
as well.
Yeah,
You know?
it's care effective.
Care effective.
That's how I feel. It's care effective. It's helping them to stay within their home, which is what they want to be, where they want to be, instead of being back in the hospital again. I mean, people want to be in the comfort of their own home. So it's like my daughter. She had surgery 2 weeks ago. She did not want to stay overnight. She did not want to stay she wanted to be home in her own bed. And we made that possible through family and nurses that I knew. We made sure she had somebody around the clock, and she recovered well, but she wanted to be home. And that's what most people feel like they want. And we try to provide that.
That's fantastic. And again, sometimes it's a friend kind of thing where you might have a need and somebody has an agency and says, we'll help you. And then you say, how much does it cost? No, just we'll take care of it. Don't worry about it. Kind of thing.
Yeah, let's say Medicare covers the cost of home health
Sure
agencies.
does.
They cover the cost of the visit fees that I incur.
And
by
it's under a
visiting.
doctor's order.
Yes, it's
Okay.
under a doctor's order.
Right.
Yes, so I write prescriptions. I prescribe. Order medical equipment. You need a hospital bed. There are mobile companies that will deliver a hospital bed to the home. So there are a lot of services.
Or a wound vac.
Or a wound vac.
I had one.
There are a lot of mobile services in the community, and we utilize them to get the care within the home so the patient can be where they want to be.
Okay, how do people get to you?
A lot of it is from word of mouth, especially at assisted living facilities, and the website, the internet. They find us through the internet, and home health agencies, because the nurses are out seeing the patients, and they feel that the patient just can't get out and see their normal PCP, and they call us and get us in there.
Idea comes to the head.
Uh-oh.
Oh, what is that?
We're going to have a meeting in another week or two of my coalition. Would your company be willing to join into that coalition?
I don't see why not.
Because it's another thing. It's unique. It's different. It would not be a great demand on any of us. I mean, we're not going to be lining up 3-4 talks a week. We may do a series of several weeks and then not do anything for a month or two. We'll talk about that. I would love to have you guys join us. And we want to build this thing with the uniqueness that we can build. And again, it's a home service. It's a necessary thing. It's a cost savings to the system. It's a cost savings in emotion to the patient, which is more important.
Yes.
And it's a direction. Somebody's going to come to your home. It's like the lady that does the placement. It's Ann Geismer, and the company is Oasis Senior Placement Services. There is a place where you can call in and say, I'm looking for an AL. And then they'll call a couple ALs in your area, and then the ALs call you and say, come on in for an interview. Well, Ann brings the person into her office and does a profile and knows every AL, IL in 2 counties and says, okay, I picked 3 for you. I think it'll be perfect. I'm going to take you and we're going to tour together. And takes them there, does the touring, the whole thing, and doesn't get paid by the patient. She gets a commission from the agency if they, move in there.
Mhm.
And what a wonderful thing to do, people on people, community kind of thing, rather than on the phone.
Yes.
Okay. And when people hear that, they say, well, you would take the time to do that? Of course. You know what? Give me some phone numbers because we're out of time.
Sure. Our office phone number is 561-323-7609. And we also have a email, reception@advent-healthcare.com. And that's monitored pretty regularly for any family members up north that need some assistance.
Well, listen, both of you, Chrissy, Donna, thank you so much for being here today. We did a lot.
Well,
Talked a lot.
thank you for
Thank
very
you.
much.
Thank you for
asking
sharing
us
all
to
this
be here.
information.
Yeah.
And again, we'll be back again next week with another guest on the forum.